Good afternoon. Since Friday, April the 17th, we have seen a 21% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 1,542 reported cases, 359 people hospitalized with COVID-19, and 60 deaths. We remain committed and focused on scaling up our response to this emergency while continuing to leverage the wealth of medical and public health experts here in Baltimore City. Over the last few weeks, we have stood up a new call center staffed by healthcare professionals to provide residents with the most up-to-date and accurate information. We have also launched a dashboard to provide residents with essential information around this pandemic. And most recently, we rolled out our broad-reaching advertising campaign. All of this in an effort to provide residents with the needed resources and to help keep them informed as we progress through this public health emergency. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptoms screening and to be connected to a physician for assessment. Today, I'm announcing the launch of a second testing site at the Rawlins Conservatory at Druid Hill Park. This new testing site is made possible through a public-private partnership with the Maryland National Guard, Total Health Care, the Office of Emergency Management, and the Maryland Department of Health. Residents without access to a vehicle will be able to access testing service by walking to the site. Although an appointment and doctor referral will still be required for testing. Testing began at the site today and expand our testing efforts and capacity, and we will be opening a site on the east side of Baltimore next week. I know I probably sound like a broken record because I keep saying the same message every week, but it's that important. We need everyone to stay home unless you need to go out for essential reasons. And I want to thank the majority of Baltimoreans who have heeded the warning and followed the guidance. You have literally saved lives. We cannot stress this enough. Avoiding hospitals and healthcare facilities when possible can actually save lives. And we're asking your help in minimizing your contact with hospital and healthcare facilities during this time. Every time you leave your house, you put yourself and everyone in your household at risk. Now I would ask our City Health Commissioner, Letitia Zavasa, to update you on our COVID response and our work to support the residents of Baltimore.
Good afternoon. Thank you, Mayor Young, for your leadership, and thanks to my colleagues and our partners for their support. There are a few updates I would like to share with you all this afternoon. As Mayor Young announced, we are proud of the fact that we were able to open a second city-supported community-based testing site at Druid Hill Park today. I want to thank our partners at the Maryland Department of Health, the Maryland National Guard, Total Health Care, and the Office of Emergency Management for their efforts to bring this testing site online today. The Druid Hill location will be on Beechwood Drive in front of the Rawlins Conservatory. Similar to our Pimlico site, the Druid Hill site will still require a physician referral and a previously scheduled appointment for residents to receive access to testing, but it will have a walk-through protocol for those without access to a vehicle. These community sites allow residents to receive access to COVID-19 closer to home and will alleviate strain on our hospital systems and clinics that are also operating testing sites. We look forward to announcing additional testing sites in the days and weeks to come. Residents are encouraged to call their physician, who can make an appointment and a referral if warranted at the Druid Park testing site through CRISP, the state's health information exchange portal. Residents without a primary care provider can contact 211 for a coronavirus symptom assessment or to speak with the medical professional. I'd also like to take a moment to address a concerning trend that's been noted by public health officials, doctors, and clinicians. We have seen an overall reduction in the number of patients going to the hospital for major illnesses not related to COVID-19. I would reiterate what Mayor Young said. For those that are well, please stay home. However, we are seeing a decline in patients seeking urgent care for things like heart attacks and stroke symptoms. These are not symptoms that will go away on their own, but instead can result in severe complications and even death if not treated in a timely manner. It is extremely important that while residents continue to practice social distancing and stay at home except for essential reasons, if you are experiencing severe symptoms of any kind, please reach out to your doctor as soon as possible or call 911. Contracting coronavirus can result in severe disease. Likewise, heart attacks and strokes can also result in severe disease and death if not treated. Hospitals remain available to evaluate and treat patients suffering from acute, life-threatening illnesses. While we understand the concern about being treated at a hospital with other sick patients, hospitals have taken precautions to protect patients, including isolation wards, separate entrances, and other infection control measures to ensure that patients without coronavirus symptoms are able to be seen and treated safely. Nursing homes and our long-term care facilities remain a top priority of the health department. We know that, again, outbreak of infectious diseases are common in nursing facilities and other spaces where people live and interact with one another, and that older adults remain at a risk for developing severe coronavirus illness. One of the first steps the health department took when we first learned of the threat of the coronavirus pandemic in December was to create GO teams to deploy to our long-term care facilities around the city to provide logistical and material support. We will continue to support our nursing facilities and other congregate settings with our GO teams and by providing additional PPE and supports as needed. Finally, the Baltimore City Health Department is proud to partner with the Mayor's Office of Children and Family Success and the Baltimore City Department of Planning for a new initiative to feed more vulnerable adults and children in Baltimore City. While my colleagues will discuss the details, the Baltimore City Health Department's Division of Aging remains committed to serving the needs of our older adults during the coronavirus pandemic. I want to thank Meals on Wheels and the Salvation Army for their key roles in continuing to serve and support our older adults during difficult times. Maryland Access Point, or MAP, is a single point of entry in the city for older adults to connect into the food resources that they need. Call 410-396-CARE, that's 410-396-2273, if you are an older adult who cannot get food and don't have family or friends to help you. Our MAP call center is available to help those in need. Thank you.
Thank you, Dr. Zavasa, and all of your staff at the Health Department for all of the hard work in safeguarding our city. Next, I want to share with you the city's expanded emergency food response to the coronavirus pandemic. But first, I want to recognize the many people behind this work: the Department of Planning, Baltimore City Recreation and Parks, the Department of Housing and Community Development, the Baltimore City Health Department, the Mayor's Office of Children and Family Success, Baltimore City Public Schools, and more partner organizations that I can name. Thank you for your hard work to minimize hunger in Baltimore during this incredible challenging time. Prior to COVID-19, 166,000 residents and more than 1/4 relied on SNAP to feed their families. Our team projects that numbers will reach 1 in 3 residents by June.
He must act and listen now.
Who is he?
This is an urgent matter. Again, my name is Mark Kelson. I am homeless as well, and I live in a shelter. He's putting my life and everybody else's life in danger. He needs to act now. Permanent housing and hotels. Not shelters and not cabins.
You're tripping for us.
We need this now. We desperately need this now. Please, please, be with me. Help us push the fact that put people in houses and permanent hotels. The permanent housing and hotels is a must for that young do. It will definitely save lives. We cannot do this in a shelter. We cannot do this in a school building. We need permanent house. That's the desperate need that we need. To stay away from one another. We desperately need that. Please, I'm begging you. I'm begging you. Please, help us. Save my life, as well as my sisters and brothers, as well as your family members that's out here. We desperately need this help. I'm not trying to interrupt you. I'm sorry. I apologize. But This is the only way I can get the mayor's attention. I desperately need this. This might be my death sentence right here, and this is my plea for right now. I am desperate need of help. I do not want to die this way. Thank you for letting me take your time.
Are you finished?
Definitely heard some home.
Thank you.
You definitely have to hear home blown.
Thank you again, Dr. Zarasov, and all of your staff at the Health Department for all your hard work in safeguarding our city. Next, I want to share with you the city's expanded emergency food response to the coronavirus pandemic. But first, I want to recognize the many people behind this work. Well, I'm just going to speak a little louder. The Department of Housing and Community Development, the Baltimore City Health Department, the Mayor's Office of Children and Family Success, Baltimore City Public Schools, and more partner organizations that I can name. Thank you for your hard work to minimize hunger in Baltimore during this incredible challenging time. Prior to COVID-19, 166,000 residents, more than 1/4 relied on SNAP to feed their families. Our team projects that numbers will reach 1 in 3 residents by June. As a result of this need, I directed the team to build out a robust strategy to meet growing demands. A core element of our strategy has been to advocate for the state to make online SNAP available to Baltimore residents. Online SNAP is more important than ever before because it allows Baltimore residents to buy groceries from the safety of their homes, which will help us to stop the spread of coronavirus. Last week, Governor Hogan authorized Baltimore to pilot online SNAP. Thank you, Governor Hogan, for authorizing a path forward for Baltimore to have a food subsidy program that better meets our needs. And I also wanted to acknowledge the Baltimore City delegation for always being a committed champion for state policies that decrease food insecurity. The expanded food strategy that we're sharing with you today builds out our current emergency food efforts, where we have already provided more than 700,000 meals in the past 30 days. Going forward, we will significantly increase current levels of food assistance, provide food supplements across age groups and geographic areas, offer residents food and grocery choice, factor in stay-at-home and social distancing requirements, and support residents who are often missed by mass food distribution channels. I want to thank my team for bringing forward this comprehensive and far-reaching strategy, and the many partners we have in this work, some of whom are here today, like Meals on Wheels, the Salvation Army, and the Maryland Food Bank. And now I'll hand it over to Tisha Edwards, Executive Director of the Mayor's Office of Children and Family Success, to share the details.
Thank you, Mayor Young. And thank you so much for your leadership and support as we have worked across multiple agencies with dozens of community partners in recent weeks to scale up Baltimore's emergency food response to meet what is a huge and fast-growing need. This effort is a testament to the deep expertise, commitment, and collaborative spirit so unique to Baltimore City, and to what is possible when we rally together on behalf of our communities in support of our most vulnerable neighbors. To demonstrate the depth and reach of the newly expanded COVID-19 emergency food strategy, I want to provide a few details on our plan forward. In the first month of our emergency response, we established 95 meal sites that included 18 schools, 42 rec centers, 25 mobile routes operated by the Department of Housing and Community Development, and 10 community sites supported by the Family League. Collectively, city agencies and our partners distributed over 700,000 meals and nearly 2,000 grocery boxes to youth and families. The expanded COVID-19 emergency food strategy will dramatically grow our reach in the next 2 months with a projected 2.5 million meals, 70,000 grocery boxes, and up to 12,000 household grocery supplements. It's really important that I acknowledge my colleagues who have worked tirelessly to develop the emergency food strategy. The Department of Planning, the Baltimore City Health Department, the Department of Recreation and Parks, city schools, the Housing Authority of Baltimore City, Department of Transportation, the Department of General Services, the Department of Finance, Family League, and the Office of Performance Management and Innovation. This has truly been a team effort. At the outset of the pandemic, the need for food assistance in Baltimore was already great. Approximately 70% of our children and youth participate in the city schools lunch program, and 28% of city residents participated in SNAP, the Federal Supplemental Nutrition Assistance Program. As economic hardship deepened with the pandemic, so did the demand for food. In response to this critical situation, Mayor Young convened a cross-agency team led by the Department of Planning and the Mayor's Office of Children and Family Success to develop a 60-day plan of action. The team projects that by June, at least 1 in 3 residents in Baltimore will require food assistance. The COVID-19 emergency food strategy has 4 elements. First, meal distribution. The city will continue to provide daily grab-and-go meals for youth and families and add community sites as needed. It will also scale up meal delivery to older adults with an expanded partnership with Meals on Wheels and the Salvation Army. The city currently serves about 800 older adult meals per month. The Baltimore City Health Department will grow meal delivery to 6,400 meals in May and up to 9,000 in June. Second, food distribution. Through our partnership with the Maryland Food Bank, the Department of General Services will operationalize a large-scale centralized food hub for assembly and distribution of grocery boxes. Distribution will begin this month with an existing inventory of 10,000 boxes. The goal is to grow distribution to an additional 30,000 boxes per month in May and June, providing a total distribution of 70,000 boxes. The city is also partnering with the Fund for Educational Excellence to deploy money donated by 11 local corporations to administer small grants to community organizations to reach children and seniors in high-need neighborhoods. Third, food retail. Our food retail efforts are focused on maximizing individual access and choice. The opportunity to launch online SNAP helps food insecure families get the groceries they need safely. For those who typically don't benefit from government programs, such as undocumented residents, Opportunity Youth, returning citizens, and individuals experiencing homelessness, we are launching a grocery supplement program. We'll start with an initial reach of 3,000 to 5,000 households, and we have plans to double the program by June. Fourth, urban agriculture. The Department of Planning will continue to lead the way in supporting our urban agricultural program by facilitating small grants, making them available to our 37 urban farms and 95 community gardens across the city. This multi-pronged strategy leverages the efforts of hundreds of community, nonprofit, business, and government partners. The city's vast network of community-based programs and assets, and existing municipal infrastructure such as transportation and staffing. The city estimates the expanded COVID-19 emergency food strategy will require an initial investment of $16 million in city, state, federal, and private funds. And most importantly, the strategy is community-driven, data-informed, and maximizes collective impact through a far-reaching network of support. Again, I want to thank Mayor Young for his commitment to feeding Baltimore. and to our many partners across the city and my colleagues in the various agencies who are helping to lead this effort. Now I'd like to introduce Stephanie Archer Smith, Executive Director of Meals on Wheels.
Thank you, Ms. Edwards. For 60 years, Meals on Wheels has delivered nutritious meals and support services to the homes of aging adults in Baltimore City and throughout Central Maryland. But never before has this service been more important, and never before has our purpose been more clear. Keep our seniors at home and out of the hospital. With the closure of the senior centers and social distancing in place, the demand for our service quickly escalated, nearly doubling in less than 3 weeks. Since mid-March, we've added 487 new Baltimore City seniors to our program, bringing our current census to 1,159 adults served throughout the city. We're proud to partner with Baltimore City to ensure this critical need is met. In mid-March, in order to keep up with the demand, we shifted our usual daily home delivery of a hot meal to a weekly meal pack complete with 2 ready-to-heat meals per day and all the extras like milk, bread, and fruit. These meals meet the Maryland State Department on Aging's nutritional requirements for adults, providing the necessary nutrients to remain healthy and safe at home. From March 17th through April 17th, home-delivered meals and meal boxes delivered in bulk to congregate living sites totaled 71,871 meals distributed throughout Baltimore City. Proper nutrition is more important now than ever. However, it's not the only thing to think about when caring for our seniors. Being isolated risks increased feelings of loneliness and depression. But being alone doesn't have to lead to loneliness. Knowing that someone is there for you makes all of the difference. That's why, in the absence of being able to perform our in-home services, we've also developed a bi-weekly check-in call program. Staffed by client support specialists, students, and volunteers, all 1,159 city participants are enrolled in the call program and are receiving wellness calls 2 times per week. We're honored to be a part of this important work and are grateful to everyone who's come together so seamlessly to protect our most vulnerable citizens, most notably our civil servants in the health department. I would also like to take a moment to thank the Meals on Wheels team, the kitchen staff, the drivers, and our volunteers who are working tirelessly in the face of unprecedented challenges and preparing meals and packing boxes 7 days a week. There are community partners of note as well. The Miscellaneous Distillery, Move the Needle, and the Flagstone Foundation have provided us with hand sanitizers and masks so that we can also keep our employees and our volunteers safe. We are inspired by your confidence in us and will continue to serve in this capacity as long as necessary. We are here when you need us most. It is now my pleasure to introduce Lieutenant Willis from the Salvation Army.
Thank you, Mayor Young and your team in the city of Baltimore. During this time of uncertainty, the efforts allows us to continue to come together as a community to provide hope to our most vulnerable neighbors. We are excited to announce that the Salvation Army of Central Maryland, largest feeding operation to this date, designed to provide 10,000 meals per day to the most vulnerable citizens of our community. As a result of this COVID-19 crisis, beginning on Monday, April the 27th, we will deliver a nutritious cold lunch and a microwavable dinner prepared by our food partner, Rouge Fine Catering, to senior living independently and across our 145 senior living facilities and residential housing, referred to us by the Baltimore City Department of Aging, the Lean Campaign, and the Maryland Access Point. Our distribution hub will take place at Lot C of the Ravens Stadium, courtesy of the Maryland Stadium Authority, where 2 refrigerated trailers are donated by Purdue Farms and are stationed to store our meals coldly each day. The Department of Transportation would provide drivers to transport our volunteers with no contact packages meals. The method of delivery is in compliance with the health and safety guidelines to protect both our volunteers and program participants. In an operation of this magnitude, could never be achieved without the collective problem solving between agencies in support of organizations alike, including the Baltimore Ravens, who have generously donated $100,000 to this effort. To carry out this effort, the Salvation Army, along with the City of Baltimore, will require a minimum of 30 volunteers per day to ensure that every senior that has been referred receives these meals per day. To join in this community effort, please visit sa-md.org/ravens to volunteer for this effort. We encourage you, and again to Mayor Young and the City of Baltimore, the Salvation Army thanks you for entrusting us to continue to meet the needs of this community.
Thank you, Lieutenant Willis, and thank you to the Maryland Food Bank. And thank you all for your partnership and commitment to this critical work on behalf of the residents of Baltimore. We'll now take a few questions. Cheryl, you want to address that?
We'll be putting out more information tomorrow in an effort to protect our employees and allow them to work from home and telework. We had to create new mechanisms so that people were able to perform customer service and actually create the bills remotely. And so we will be announcing when the water bills will go out, but that's caused a couple-week delay in getting the water bills out.
Mary Young, what's your plan for preventing spread of the virus amongst unhoused individuals?
Say that again.
What's your plan for preventing spread of the virus amongst unhoused individuals?
Of homeless individuals, say? Have you seen all the information we've been putting out daily on my website, on the Health Department's website, Homeless Service website? We're doing a whole lot to support homeless people.
Can you give us
Sure.
an update on just how many people are housed?
Sure. So the city has relocated about 160 homeless individuals who are 62 and over, who were not impacted by COVID. So they've been relocated into hotel settings to help isolate them and protect them from the spread of the virus. The city also created another shelter environment and moved 155 homeless individuals out of existing shelters into a much larger facility to allow for more social distancing in that facility as well as the remaining shelters. The city also opened an isolation location, which was a motel starting on March 20th. That location has approximately 100 hotel rooms, and they are currently full. So we are currently isolating 100 people who have either tested for COVID-19 or are awaiting their test results or have tested positive.
I guess the other thing is what's the reasoning for not?
All right, so we only have a couple more questions. So if any of the members of the media have anything, go ahead, Jane.
Jane?
And then they can't go to a shelter for fear of
Governor
infecting
yesterday
others.
announced that the state has purchased directly from South Korean company 500,000 tests. Does the city expect to get, how much of that does the city expect to get?
Come on. We're hoping to get a lot. Come on.
We haven't been notified of an exact amount, but we are hoping to get a fair share.
And to this point, how many tests or test kits, however you want to phrase it, but just be specific about it, has the city been provided by the state?
So we've been provided with 100 tests a week to support our community-based testing sites.
And you anticipate that number is going to go up now?
I hope so.
And has the city purchased any on its own?
We have. So we have supported tests as well to support those same community-based testing sites.
All
right, thank you, guys. Thank you.
Thank you.
Thank
Thank you. Thank you.